Hey, I'd like to welcome you to another episode of Mission Matters. My name is Adam Torres, and if you'd like to apply to be a guest on the show, just head on over to missionmatters.com and click on Be Our Guest to apply. All right, so today's episode is part of our Milken Global Conference, a coverage series where we bring to you the best of the conference participants, speakers, panelists, VIPs, all of the above. And our guest today is Mark Del Monte. He is the CEO and Executive Vice President over at the American Academy of Pediatrics. Mark, welcome to the show.
Thanks, Adam. Thanks for having me.
All right, Mark. So lots to talk about today. So, of course, I want to get into what you're doing over at the American Academy of Pediatrics and really how we can improve the health of America's children overall. But before we get into that, let's get into the Milken Global Conference a bit. So that's my Super Bowl of conferences. I say I go every year for going on 3 to 4 years. I do not miss it. What's your connection to the conference? Have you been in the past? Is this your first year? Talk to me. What's your connection?
Yeah, great. It was my first time at the Global.
All right, a newbie at the Global then. I'm loving that. That's what I'm talking about. Go ahead, please.
Yeah, it was great. I had been to the Future of Health Summit before that the Milken Institute sponsored, and it was on a panel there and had a great time at that meeting in D.C. And so that sparked my interest to go to the Global Conference in Southern California. And it was a remarkable experience. There was so much healthcare innovation on display, and the speakers were great. I had a great time.
Obviously, with your position, you're obviously in healthcare conferences, you're going to a lot of different things. Like that's just part of your day-to-day. What do you feel made this conference stick out, or what made it special, and what made it to where you had to attend? Because I know you've been to the regional conferences you mentioned.
Yeah. It's a really interesting and different meeting than meetings that I get to go to frequently. We get to go to a lot of healthcare meetings, and one of the exciting things about that is it's so cross-sector. There are people from all kinds of different aspects of business and finance, people in healthcare, economics experts, all around different aspects of business and innovation. And so it's a rare opportunity to talk with all of those groups at the same time. It is really a unique conference in my experience.
Yeah, I have to completely agree with that. And that's one of the reasons why I don't miss it year after year. But again, 3 to 4 years in, and I'm going to continue to go because I love covering and we get great interviews out of it. So switching topics here slightly, Mark. Let's start with the American Academy of Pediatrics. Maybe start by telling us a little bit more about the organization.
Sure, thanks. The American Academy of Pediatrics is pretty well known to folks. It's the organization of pediatricians in the United States and with members all around the world as well. We have 67,000 pediatrician members that run from community pediatricians who take care of children and well child visits and all that to hospital-based pediatricians or pediatric surgeons. And so the organization was founded exactly 95 years ago. We had a 95th anniversary just at the beginning of July. And what makes AAP unique even among medical societies is that AAP has a child health mission. And we are here to, of course, make sure that doctors are practicing great medicine and have great education. But really, the AAP has always been about advancing the cause of child health, making the world better for children and making children healthier and more able to thrive into the future.
Yeah, that's wonderful. And with that big 100 coming up, right? That sounds interesting here. I feel like a couple years away. This is exciting. Let's go further into the topic. So obviously with its mandate, what are some of the dangers of maybe what's going on right now or the potential of cutting funding for things like Medicaid, CHIP, and really other programs that were designed for children and that some families rely on?
Yeah, thanks for the question. It's a really important time to be thinking about ways that we can use public policy, federal policy, or policy at the state level to really advance the cause of children. And so much of what we're seeing right now is worrisome. We hear from parents and from our members all the time that it's really tough to be a parent right now. How to face the world with all the things going on and to make sure that you're providing the best information and the best opportunity for your children. It's a real big challenge. And from, social media to vaccination and access to health care, mental health is a big concern. There's a lot of things on families' radar right now. And I find that it's just tough. Parents are getting messages from all kinds of everywhere, social media and the rest, that tell them that it's just tough to be a parent, and I want to be able to support parents. Most parents are doing a great job and they're caring for their children in wonderful ways. And pediatricians want to do everything they can to support them and to make sure that their children grow up happy and healthy.
Yeah. Talk a little bit more about, what and obviously I'm not asking you to have a crystal ball, but you're doing this day in and day out, and you have a super unique vantage point leading an organization with, 67,000 plus members. That's huge. So you have a lot of data. You have a lot of feedback. What are some components, or I don't even know how to ask this question, right? But what are some of the components that an ideal healthcare system that was looking out for children, and putting children first?
Oh, that's a great question, Adam. So let's start by thinking about who children are. And so if you look at children in the United States, about half of kids in the U.S. are growing up poor. They are poor enough and living in poor families enough to qualify for Medicaid, which is health insurance provided by the federal government. We just have been talking to Congress a lot about Medicaid recently because they are seeking to cut the number of people who are covered by Medicaid. But that half of kids who really need health care through the Medicaid program, they also need nutrition support through SNAP. They need housing support because their families are struggling to get by. They need access to health care and vaccinations and schools where they can get nutritional meals. And so I think if you start by thinking about the population of kids and design a system around those children, you'll probably get it right for everybody else. So imagine if we had a healthcare system for all children that focused first on their healthy development. So what is everything that a child needs to grow up happy and healthy? So what does that mean from nutrition and exercise, education, healthcare, vaccinations, and all of those healthy child visits that parents take their kids to in the early days of life? Too many children don't have access to the basics that they need to grow up and thrive. And so if we built a healthcare system with children in mind, I think we would make sure that all children had access to high quality health insurance so that they could get the best medical care possible. They would get access to excellent schools and safe environments where they could play outside. They could live in an environment where the air is clean and they can be outside in safety. And so I think from a policy perspective, if we start with the kids and build a system around them and their families, we'll do much better than we are doing right now.
Yeah, and everything you described sounds like something that, who would argue, oh, well, we don't want that for our kids? I mean, it sounds so basic what you're saying, but I get it, though. If you could design and achieve those objectives for children, then we're all going to benefit.
Exactly. And I think, there's so many challenges today for families. I mean, people struggle with how much time should I let my child be on the iPad? How much time should I let my child be playing video games or online gaming? And those are hard questions and really changing the way children are growing up. Whereas, years ago when I was growing up, people rode their bikes outside and there was a lot more outside time. We see less of that in kids. We're worried about them being inside too much, and then we're worried about their exercise levels. And so I think we have a real opportunity to reimagine what childhood can be like. And that's an exciting thing. It's not all just a basket of negative things to worry about. There's a lot of positives that we can think about too.
Yeah, absolutely. Mark, what kind of trends are you following? And I'm asking this broadly, intentionally. I mean, it could be legislation, technology, just in general. What kind of trends are you following? What excites you about what you're doing?
Well, I think the number one thing that we are talking about most right now is measles. People are very concerned about a measles outbreak or the outbreak of pertussis or other vaccine preventable diseases. There's lots of discussion about vaccines right now that are making families worry. And so we want to be very reassuring to everybody that the science and evidence is really clear that vaccines are safe and effective and are the best way to prevent infectious diseases, and that we want to encourage people to talk to their pediatrician about any questions that they have about vaccinations. But I think, that is just a front and center topic for us all over the country. Shortly, close behind that, I would say, is mental health. We're seeing tremendously worrying amounts of depression and anxiety among kids, even among very young kids. People are worried about social isolation in schools, a lot more concerns about their children's mental health.
Wow, I can see that. So it's kind of almost on trend as with adults, right? Like rises in mental health and other things that are happening. I'm not saying one for one, or I don't know the data, but I just mean in general, it sounds like it's a societal epidemic, but for our kids to be, young experiencing that, that's the thing. Wow.
Yeah, it's a real worry. It is a real worry. And I think pediatricians can help, but so can, the school counselors and psychologists. There's lots of people trying to think really hard about how to make the world feel safer and make children feel more secure in it. But we have kind of a collective opportunity here as a society to really wrap our arms around all kids and work on this mental health crisis together.
Amazing. Mark, this has been great having you on today and learning more about the American Academy of Pediatrics. And of course, individuals listening to this show are going to want to follow up, learn more, connect. How do people do that?
Sure. We have a great website that is designed for families so that they can go and get great information about children at all ages. And it's called healthychildren.org, just like it sounds, healthychildren.org. And then for information about the American Academy of Pediatrics, you can just go to aap.org, and then we'd be happy to see you there.
Fantastic. And for everybody listening, just so you know, we'll definitely put some links in the show notes so you can just click on the links and head right on over. And speaking of the audience, if this is your first time with Mission Matters and you haven't done it yet, hit that subscribe or follow button. This is a daily show. Each and every day we're bringing you new content, new ideas, and hopefully new inspiration to help you along the way in your journey as well. So again, hit that subscribe or follow button. And Mark, thanks again for coming on the show.
Thanks, Adam.